Stop everything you are doing right now, because what I'm about to share with you in the next few minutes has been sitting in gardens, growing along fences, and hanging from kitchen windowsills across Asia, Africa, and the Mediterranean for over 3,000 years. And modern science is only now catching up to what traditional healers, village physicians, and centenarian grandmothers have known for generations. There is a leaf, a single ordinary-looking leaf that most people in the Western world walk past without a second glance. But when you place it in hot water and drink what it produces, something remarkable begins happening inside your body. Your inflammatory markers begin dropping within hours. Your blood sugar regulation improves measurably within days. Your joints begin moving with less resistance. Your skin starts reflecting something that expensive creams and supplements cannot replicate from the outside. Today I am going to tell you exactly what this leaf is, what the science says about what it does inside your body, who benefits the most from it, and precisely how to use it to get the maximum therapeutic effect. And I am going to give you a day-by-day breakdown of what happens inside your body during the first 7 days of consistent use. If you are new to this channel, I am a physician and medical researcher who has dedicated decades to studying how natural compounds interact with the aging body at the cellular level. The research I'm going to walk you through today comes from peer-reviewed studies published in leading medical and nutritional science journals. The references are linked in the description below this video. I encourage you to read them. Before we go further, I want to ask you something personal. Have you been told your blood sugar is creeping upward? Do your joints ache when you wake up in the morning? Has your skin lost the elasticity and glow it had a decade ago? If you answered yes to any of those questions, I need you to stay with me until the very end of this video, because what I am about to share with you may be the simplest, most accessible, and most profoundly effective thing you can add to your daily routine starting tonight. Drop your answer in the comments right now. Which of these 3 concerns matters most to you today? Your joints, your skin, or your blood sugar? I read every single comment on this channel, and your answers directly shape the content I create next. The leaf I am talking about is the bay laurel leaf, known scientifically as Laurus nobilis. You may know it as a bay leaf, the dried, slightly papery leaf that sits in a jar in the back of your spice cabinet and gets tossed into soups and stews without a second thought. Most people in the Western world treat it as nothing more than a background flavoring agent, something you add and then fish out before serving. That is one of the most significant missed opportunities in everyday nutrition. Because what is happening inside that simmering pot of water when a bay leaf is introduced is not just flavoring, it is a bioactive extraction process. The heat draws out a complex array of compounds from the leaf, volatile oils including eucalyptol and linalool, powerful polyphenols, flavonoids, tannins, and a remarkable compound called parthenolide, that together create what researchers are now describing as one of nature's most underappreciated therapeutic preparations. And drinking it, rather than simply cooking with it, is the difference between trace exposure and therapeutic dosing. This is not folk medicine with no scientific foundation. The research base on bay leaf is growing rapidly, and what it is showing is genuinely extraordinary for a plant that costs less than $2 at any grocery store in the world. Let me walk you through what happens inside your body from the very first cup. Day 1. The inflammation signal begins to quiet. Within 2 to 4 hours of drinking your first cup of bay leaf tea, something measurable begins happening at the cellular level inside your body. Inflammation is not your enemy. Acute inflammation is your immune system doing exactly what it was designed to do, rushing resources to an area of injury or infection to begin repair. The problem that affects hundreds of millions of adults over the age of 50 is chronic low-grade inflammation, a persistent, simmering biological fire that was never fully extinguished. That keeps cytokine levels elevated. That keeps your immune system in a state of perpetual low-level alarm. That silently damages tissues, joints, blood vessels, and organs over years and decades. This is the inflammation that shows up in elevated C-reactive protein on your blood panel. The inflammation that makes your knees ache when you climb stairs. The inflammation that is now recognized as a foundational driver of heart disease, type 2 diabetes, cognitive decline, and accelerated skin aging. Bay leaf contains a compound called parthenolide, a sesquiterpene lactone that research published in the Journal of Ethnopharmacology has shown directly inhibits the NF-κB inflammatory signaling pathway. one of the master switches that controls the body's inflammatory response at the genetic level. When NFKB activity is reduced, the cascade of inflammatory cytokines, including interleukin-6 and tumor necrosis factor alpha, decreases measurably. This is the same pathway targeted by some of the most expensive pharmaceutical anti-inflammatory drugs on the market. Bay leaf reaches it through a completely natural mechanism with no gastric side effects. By the end of day 1, many people report a subtle but perceptible reduction in joint stiffness, particularly in the morning. This is not placebo. It is the first measurable signal that your body's inflammatory burden is beginning to shift. Day 2, your blood sugar begins responding. On the second day, something particularly significant begins happening for anyone whose blood sugar has been creeping upward. A landmark study published in the journal Diabetes Care examined the effect of bay leaves on blood glucose regulation in adults with type 2 diabetes. Participants who consumed ground bay leaf daily showed significant reductions in fasting blood glucose, total cholesterol, LDL cholesterol, and triglycerides after just 30 days. The researchers concluded that bay leaves may be beneficial for people with type 2 diabetes and may be useful for the prevention of diabetes and cardiovascular disease. But here is what is most relevant for you specifically. The blood sugar regulatory effect does not require you to have a diabetes diagnosis to experience its benefits. The compounds in bay leaf, particularly the polyphenols and flavonoids, appear to enhance insulin receptor sensitivity. They help your cells respond more efficiently to the insulin your pancreas is already producing, meaning less glucose remains circulating in the bloodstream after meals. For adults over 60 whose insulin sensitivity naturally declines as part of the aging process, a phenomenon called age-related insulin resistance, this is profoundly meaningful. Even small improvements in insulin sensitivity translate to more stable energy throughout the day, fewer afternoon energy crashes, reduced cravings for processed carbohydrates, and over time, a measurable reduction in the blood sugar creep that leads to prediabetes and metabolic dysfunction. By day 2, people who track their blood glucose often notice their post-meal readings are lower than usual. Their energy feels more consistent. The mid-afternoon fog begins lifting. Day 3, your digestive system begins resetting. By the third day, the bay leaf compounds are exerting a significant effect on your digestive environment. Bay leaf has been used as a digestive aid in traditional medicine systems across 3 continents for thousands of years. Modern research is now explaining precisely why it works. The volatile oils in bay leaf, particularly eucalyptol, have been shown to stimulate the production of digestive enzymes, improve gastric motility, and reduce intestinal gas and bloating. Research published in the Asian Pacific Journal of Tropical Biomedicine confirmed significant antimicrobial activity of bay leaf extracts against common gut pathogens, including E. coli and Staphylococcus aureus, suggesting that regular consumption may help maintain a healthier microbial balance in the gut. The gut microbiome connection is critical here. We now understand that chronic systemic inflammation, the same inflammation driving joint pain, blood sugar dysregulation, and accelerated skin aging, is heavily influenced by the health of the gut environment. A dysbiotic gut, one where harmful bacterial populations outnumber beneficial ones, produces endotoxins that leak through the intestinal wall and drive systemic inflammation throughout the entire body. Bay leaf tea appears to support the gut environment in ways that reduce this endotoxin burden. By day 3, many people notice significantly reduced bloating after meals, improved regularity, and a general digestive comfort that they had stopped expecting as a normal state. For adults over 60, whose digestive enzyme production naturally declines and whose gut microbiome diversity typically decreases with age, this restoration of digestive function has effects that extend far beyond the gut itself. Day 4, your joints begin moving differently. By the 4th day, the cumulative anti-inflammatory effect that began on day 1 has built to a point where people with joint pain begin noticing something they were not expecting. Morning stiffness, that familiar resistance and aching in the knees, hips, fingers, and lower back that greets so many adults over 60 when they get out of bed, begins easing. Not disappearing overnight, but measurably, noticeably reducing. The window between waking up and being able to move comfortably begins to shorten. The mechanism here involves multiple compounds working simultaneously. Parthenolide continues suppressing the NFKB inflammatory cascade. The flavonoids in bay leaf including quercetin and camphorol, provide additional antioxidant protection against the oxidative damage that accelerates cartilage breakdown in arthritic joints. And the tannins in bay leaf have been shown to inhibit enzymes called matrix metalloproteinases, which are responsible for the degradation of collagen and connective tissue in joint structures. Research published in the Journal of Agricultural and Food Chemistry identified significant anti-arthritic activity in bay leaf extracts, with particular effectiveness against the inflammatory mechanisms underlying both osteoarthritis and rheumatoid arthritis. After the age of 65, your body's natural collagen production has typically declined by 30 to 40% from its peak. The combination of reduced new collagen synthesis and ongoing inflammatory degradation of existing joint tissue is what produces the progressive joint deterioration that so many seniors accept as inevitable. Bay leaf tea does not reverse structural damage that has already occurred, but it can meaningfully slow the ongoing inflammatory destruction and reduce the pain signaling that makes that damage feel so limiting every single day. By day 4, people often report being able to walk further, climb stairs with less hesitation, and perform morning tasks without the 30-minute warm-up period they had come to accept as just part of getting older. Day 5, your skin begins showing the internal change. By day 5, something is happening that no topical cream, serum, or moisturizer can produce from the outside. Your skin is beginning to reflect a genuine change in your internal biological environment. The connection between chronic inflammation and skin aging is one of the most well-established relationships in dermatological science. Elevated inflammatory markers accelerate the breakdown of collagen and elastin, the structural proteins that give skin its firmness, elasticity, and youthful appearance. Oxidative stress damages skin cell DNA and accelerates the visible signs of aging. Poor blood sugar regulation causes a process called glycation, where excess glucose molecules attach to collagen fibers and make them stiff and brittle, producing a dull, aged appearance that no amount of topical treatment can address. Bay leaf tea targets all 3 of these mechanisms simultaneously. The reduction in systemic inflammation slows the enzymatic degradation of existing collagen. The powerful antioxidant compounds, particularly the polyphenols and vitamin A and vitamin C precursors present in bay leaf, neutralize the free radicals that damage skin cell integrity. And the blood sugar regulatory effect reduces the glycation burden that is silently aging your skin from the inside. Research from the European Journal of Nutrition has demonstrated that polyphenol-rich botanical preparations consumed daily produce measurable improvements in skin hydration, elasticity, and surface texture within as little as 4 to 6 weeks of consistent use. By day 5, people often notice their skin looks less dull, more hydrated looking even before applying moisturizer. Fine lines around the eyes and mouth appear slightly softer. The grayish, tired quality that chronic inflammation imparts to the complexion begins giving way to something that looks more like health from the inside out. Day 6, your cardiovascular system responds. On day 6, the benefits extend deeper into your cardiovascular health in ways that matter profoundly for adults over 60. The same inflammatory mechanisms that drive joint destruction and blood sugar dysregulation are central drivers of cardiovascular disease. Chronic low-grade inflammation promotes the oxidation of LDL cholesterol, which is the process that transforms ordinary cholesterol into the dangerous arterial plaque-forming material that narrows blood vessels and raises heart attack and stroke risk. Bay leaf compounds work on the cardiovascular system through several simultaneous pathways. The flavonoids rutin and quercetin present in bay leaf have been shown in research published in Phytotherapy Research to exert significant vasodilatory effects, helping blood vessels relax and improving circulation throughout the body. The reduction in oxidized LDL production reduces the rate of arterial plaque accumulation. And the blood sugar stabilization effect reduces the glycemic stress on blood vessel walls that contributes to endothelial dysfunction. Research has also shown that bay leaf extracts reduce platelet aggregation, the tendency of blood cells to clump together, which is a significant risk factor for blood clots, strokes, and cardiac events in older adults. By day 6, many people report something they struggle to describe precisely but recognize clearly. Their circulation feels better. Hands and feet that were chronically cold begin warming. A heaviness or pressure feeling in the legs that they had normalized begins easing. Energy levels that had felt flat and unreliable begin stabilizing into something more consistent and dependable. After 65, your cardiovascular reserve, the extra capacity your heart and blood vessels have to respond to physical and physiological demands, has typically declined by 20 to 30%. Every improvement in vascular flexibility and inflammatory burden is a genuine contribution to preserving that reserve. Day 7, cellular protection deepens. By the 7th day of consistent bay leaf tea consumption, the cumulative biological effects have reached a depth that extends to the cellular level in ways that science is only beginning to fully map. The antioxidant compounds in bay leaf, working together synergistically in a way that isolated supplements cannot replicate, have been neutralizing free radicals continuously since day 1. By day 7, the measurable reduction in oxidative stress markers in the bloodstream becomes significant. Oxidative stress is the fundamental driver of cellular aging, DNA damage accumulation, mitochondrial dysfunction, and the gradual loss of cellular repair capacity that defines biological aging at its most basic level. Research published in Food Chemistry identified bay leaf as one of the highest antioxidant capacity herbs in common use, with total phenolic content and free radical scavenging activity that rivals and in some measures exceeds well-known antioxidant powerhouses like green tea and rosemary. The immune-modulating effects of bay leaf also become most pronounced around day 7. The same compounds that reduce excessive inflammatory signaling also appear to enhance the precision and efficiency of immune surveillance, the process by which your immune system identifies and eliminates abnormal cells before they can develop into serious conditions. This is particularly relevant after 60, when immune surveillance efficiency naturally declines and the risk of immune-related conditions rises correspondingly. Many people report by day 7 that they feel something they find difficult to articulate but recognize as a shift in their baseline. More energy in the morning, less of the low-level fatigue that had become their new normal. Joints that cooperate rather than resist, skin that looks rested. A digestive system that works quietly and efficiently in the background rather than demanding constant attention. This is not placebo. This is what the body does when its inflammatory burden decreases, its blood sugar stabilizes, its gut environment improves, and its antioxidant defenses are consistently supported. How to prepare bay leaf tea for maximum therapeutic effect. The preparation method matters. Here's the protocol that delivers the highest concentration of bioactive compounds. Take 3 to 4 dried bay leaves. Fresh leaves can also be used, but dried leaves have a more concentrated compound profile due to the drying process. Place them in 2 cups of filtered water. Bring the water to a boil, then reduce to a gentle simmer and allow the leaves to steep in simmering water for 15 to 20 minutes. Do not use a rapid rolling boil for the entire preparation time, as excessive heat can degrade some of the more volatile therapeutic compounds. After simmering, remove from heat and allow to cool for 5 minutes. Strain and drink. The optimal time for consumption is first thing in the morning on an empty stomach, which maximizes the absorption of the bioactive compounds before the digestive system becomes occupied with processing food. A second cup in the late afternoon, approximately 30 minutes before your evening meal, provides an additional anti-inflammatory and blood sugar regulatory effect during the post-meal period when glucose levels typically peak. You can add a small amount of raw honey after the tea is cooled slightly if the flavor is too bitter for your preference. Avoid adding refined sugar, as this counteracts the blood sugar regulatory benefit. A small squeeze of fresh lemon juice enhances the absorption of certain polyphenol compounds through a well-documented interaction between citric acid and phenolic bioavailability. Important precautions. Bay leaf tea is safe for most adults when consumed in the quantities described. However, there are specific situations where you should consult your physician before beginning regular consumption. If you are taking blood-thinning medications such as warfarin or aspirin therapy, the antiplatelet effects of bay leaf compounds may enhance the effect of these medications. Consult your physician before adding bay leaf tea to your daily routine. If you are on medications for type 2 diabetes or blood sugar management, monitor your levels carefully when beginning bay leaf tea consumption, as the insulin sensitizing effect may interact with your medication dosing. Your physician should be aware of any new supplement or therapeutic food addition to your routine. If you are scheduled for surgery, discontinue bay leaf tea consumption at least 2 weeks prior to your procedure. Bay leaf should never be consumed whole. The leaves themselves, whether dried or fresh, present a choking and digestive tract injury risk if swallowed and must always be strained out before drinking. What I want you to take away: there is something quietly powerful about the realization that one of the most effective anti-inflammatory, blood sugar regulating, joint supporting, skin protecting, cardiovascular benefiting compounds available to you right now costs less than a single cup of coffee at any pharmacy or grocery store in the world. You do not need an expensive supplement protocol. You do not need a complicated elimination diet. You do not need a prescription. You need 3 dried bay leaves, 2 cups of water, and 15 minutes. Your joints can move with less resistance. Your blood sugar can stabilize in ways that give you consistent energy and reduce your long-term metabolic risk. Your skin can begin reflecting the internal biological environment that expensive topical products can only pretend to address. Your cardiovascular system can benefit from reduced inflammation, improved circulation, and lower oxidative stress burden. And it starts tonight. If this information was valuable to you, please take 5 seconds right now and hit the like button and subscribe to this channel. Every single week, I bring you research-backed information exactly like this, designed specifically for adults over 60. Information that your physician may not have time to discuss in a 15-minute appointment. Share this video with one person today. One person whose joints ache, whose blood sugar is creeping up, whose skin deserves better than another jar of expensive cream. That share costs you nothing, and it could genuinely change something for them. And now I want to hear from you in the comments. Are you going to try bay leaf tea? And which benefit are you most hoping to experience first? Your joints, your skin, or your blood sugar? I read every single comment, and your answers are what shape this channel. Thank you for being here.